So, namaskarams to everyone. Cancare Foundation is an NGO organization which basically looks at supportive and palliative care for cancer patients. So, palliative care and supportive oncology is a very important component of cancer care, because many patients would ultimately need this help, as cancer in India presents in a late stage because of awareness, lack of it, because of distances which people have to travel, and lack of trained oncology facility across various parts of our country. So, many patients would need comfort care and palliation. So, this is the area in which Cancare Foundation is aggressively working, and this is an NGO which has social workers like Akila Srinivasan, Mrs. Ranganayaki, Chitra Mahesh, Dr. Janardhan Akkani, Dr. Ayyappan, Dr. Mani Chandrasekhar, Dr. Vikas Mahajan, and myself. So, this is a group which has doctors who are trained in oncology and who supervise palliation. So, the three aims of this organization is mainly to provide a palliation to the patients at their doorstep, for which we have a well-trained home care system. In the home care system, we are able to reach the patient at their house and provide basic comfort. Small procedures like catheterization, ascitic fluid tapping, Ryle's tube placement, wound dressing, all can be provided at the comfort of their house, and the patient need not move long distances or wait for hours to see the physician. Also, at the home, we are able to provide a Fowler's cot. We are also able to provide nebulizers and oxygenator. In a month, we do almost about 150 to 200 house visits, and these numbers have been steadily increasing over the years from when we started, that is in 2010 November. So, as of now, we have done almost around 8,000 visits at the home. The next important component where we are actively working is hospital based palliation, or also called as the hospice center. So, at Ramarao Hospital, which is on Punamali High Road, we have 5 dedicated beds where, when we are not able to handle the patient at home, or we need to provide respite care for the caregivers, or there is increasing pain or complications like aggressive bleeding or large volume vomiting, which is not we are not able to manage at home, we are able to bring these patients to our in-house facility at Ramarao, take care of them. So, to do this, we have a palliative care trained physician who is a MD physician, and with her there are about 8 to 9 trained sisters in palliative care, and these sisters have undergone their training at various centers in India, in Trivandrum and in Kozhikode, etc. And this forms the basic bulk force of our palliation, which is both at home and also in the hospital. The second very important component is education and awareness in palliative care. So, for this, in the last 2 years, we have been conducting various meetings specifically focused at the nursing staff. So, we have conducted meetings at various nursing colleges, and then we have conducted meetings in our awareness camp, specifically designed modules to teach the nursing students regarding palliative care and its importance. To further knowledge, in 2016, we did a national level meeting on palliative care, where we invited oncologists, doctors interested in palliative care, and sisters and also psycho-oncologists across South India and Chennai. We had national and international speakers. It was a well attended meeting where we were able to disseminate this knowledge on palliative and supportive oncology. To further the knowledge transfer, we have now presently tied up with Rajalakshmi College, where we are doing a 28-hour module, and then at the end of the module, an exam for the students, and the students who pass the exam would also get a certificate, and these students also are getting hands-on training in our hospice center. The third very important component now we are looking, which is yet to be done, is to get an accreditation from an international organization, that is basically a European Society of Medical Oncology, to get our accreditation. So we are working actively towards that. The whole team needs to do few more things. Particularly, we need to show some research involvement to look at quality of life issues in these patients, and in the coming few months I am very certain that we will be able to fulfill most of the criteria which are needed for the same. So I think this is the work which we are able to do from Cancare Foundation. An important point is all this is done free of cost. There is no expenditure involved to the patient or to the family, and drugs, particularly narcotic drugs in every form, like morphine or patches in the form of Duragesic patch or Fendrop patches, and also we also use lollipops, narcotic lollipops, all we are able to supply and provide to the patient without any cost. So I feel that more people or more patients, and specifically more doctors and oncologists, should utilize this service. They can easily contact us through this website and this particular phone number which is there. They could intimate us, and within 24 to 36 hours our team member could reach and examine the patient, and the primary doctor who is referring can get the updates, and if he or she wants a particular direction or a particular treatment to be done, our doctors who are trained will execute the orders. So the main intention would be to reach out to more patients and to ensure that we are able to provide a comfortable life at end of the last month or 2-3 months of their life, and death with dignity to everyone. Thank you.